What is happening, people? Dr. Z here in Solo Time, episode number 149. Um, and today we have a pretty important topic. We're going to be talking about the complications of diabetes. And so, usually, what are the complications of diabetes? We talked about the complications of diabetes in the small vessels and what diabetes
happening, people?
creates
Dr. Z here in Solo Time.
in the small vessels, and then we're gonna be talking about what diabetes happens and it creates on the large vessels. There was some sound coming in, so it was a little crazy, but okay. Um, so the small vessels we talked about that it causes the eyes, our eyesight. We talked about the kidneys. And so the eyesight was the retinopathy. We talked about the kidneys, the nephropathy, and we talked about the neuropathy, which is um, in the nerves. And those are caused by small vessels. So if you think about small vessels, it's like the little roads, not the highways, right? And so today we're going to be talking about the complications that diabetes has caused by the big vessels, like the highways of the body, the big vessels. And the main thing that is the common denominator in this is actually the what is called atherosclerosis, right? So atherosclerosis is just when plaque accumulates, and plaque is made of a bunch of stuff that we're going to be talking about, but it accumulates inside of the vessel, and then it starts creating damage inside of the vessel. And so if you think of it as like a water hose, it start accumulating inside of this water hose, and usually what is caused the main blockage is not that the vessel gets so clogged up that it eventually closes, but it actually happens that it's an injury inside of the vessel because of this plaque, this accumulation. It makes it weaker, and then it ruptures. And then when it ruptures, then it can actually create uh, blockage. And so what is inside of this plaque is actually a combination between inflammatory cells and then collagen, which is this protein that makes a lot of our blood vessels. And so this is what is called the atheroma. The atheroma is when all of this is like combined. It's almost like it's like an accident. You see everybody coming into the accident. You see like cars, and like um, you see like an ambulance, and you see the police. So just imagine if, like, many times it doesn't cause a complete blockage of the road, but imagine if there was an explosion even after that, then that would completely block the road. And so that's what happens in the body. There is an explosion of this accumulation of things called the atheroma, and then that creates the blockage in the vessel. And so the crazy thing is that there's a bunch of risk factors that make this happen, and some of these risk factors are like age, whether we have diabetes or not, if we have low activity levels. And so all of these cause from injury to the artery, and all of these factors come together to be able to cause all of these problems. So rather to think about it as it's like a single episode, is almost like a continuous injury of this issue is continuously damaging until one day, boom, the last drop hits, and then that explosion happens, and then you get the problem that is being caused, which is the clogging of the artery. And then because there is no blood going through, all the tissue, um, farther away from the vessel, or that the vessel was supplying oxygen with or fuel with, then it starts dying. And so the first thing we're going to talk about is heart disease, right? And so heart disease is the most feared. We fear it the most because we hear about it all the time, heart attack. And so a heart attack is when the vessels inside of the heart actually get clogged like that with these atheromas, they explode and then they block the arteries, and then the tissue of the heart that was fueled by the artery actually starts dying. And so here's the crazy thing, right? There's a strong association with heart disease and diabetes. In the 70s, there was a large study that was done, and it's called the Framingham study. And this study connected diabetes to heart disease by 2 to 4 fold increase. So about 68% of the people that have diabetes and that are 65 or older will die of a heart attack. 68%. And about 16% of diabetic patients will die of a stroke that are 65 or higher. So reducing the risk. So pretty much, if we can get away from diabetes, that's the first thing. And then the second thing is reducing the risk of these diseases is of great importance and to improve our heart and the functions of our heart. You know, heart disease has improved a lot, and so we get a lot better. We have gotten a lot better to improve heart disease, but not diabetic heart disease, because that's the main issue that we're struggling with, and that's what I'm in a mission to be able to help people through, because it a lot of times takes changes that are personal changes to be able to overcome that issue. And so that is with the heart, right? The complications with the heart. The next thing we're going to be talking about is the stroke, the complications of the big vessels from diabetes, and it causes a stroke. So think of a stroke almost like a heart attack in the brain. It's almost the same thing. It can be caused either by bleeding or because by lack of blood into the brain. Bleeding is almost like spilling water into a computer board. That's how it happens in the brain. You just think about that, and then because of the lack of or blockage, just like a heart attack, right? And so this same thing happens. The atheroma gets built in the vessels that are going into the brain, and then they rupture, and then they block it, and then that part of the brain dies. So here's a crazy, crazy, crazy statistic. If you have diabetes, um, it can increase your chances of having a stroke by 150 to 400%. And a quarter of all new strokes happen in diabetic patients. So 150 to 400%. Pretty crazy numbers. So definitely, with by getting away from diabetes, overcoming diabetes, will definitely decrease those chances of having a stroke. Is pretty crazy. So, and then the last complication is peripheral vascular disease. So peripheral is like the peripherals, meaning like our limbs, and then vascular, the vessels, and then disease, of course, and illness. And so peripheral vascular disease is just the blockage of the vessels mainly supplying our legs. And so these the main symptom that people feel is that if they're walking, they start feeling pain. If they stop, the pain goes away. And so that's peripheral vascular disease until proven otherwise. And if you have that, very important to get checked out right away and to get a hold of the diabetes, because that means that if you have it there, then you probably have it in your heart or in your brain. So that's one of the most common symptoms. And then the other symptoms is that wounds will not heal. You often hear of like diabetics having to have their foot get cut off, so or amputated because of this, because the wounds do not heal, and because the nerves have been damaged, as we spoke in the past, then they don't protect them as well. And so those are the main complications from the large vessels of how diabetes affects the body. Now, one of the most important things to talk about is that we used to think that this was irreversible, but then there was a lot of work being done, especially one of the biggest works was done by Dr. Ornish, and he realized that this damage was actually reversible, that these atherosclerotic disease, this blockage of these arteries could actually be reversed by taking different approaches to life. So if you're listening to this, I don't want you to feel like this is like you're like powerless or anything like that. I want you to realize that there is a way that you can actually change this, and then there is a way that you can actually improve and actually reverse these issues. So that's the main focus of this thing. And so then the next in the next episode, we're going to be talking about the effects, other complications that have been shown by diabetes, and then so that we can know about them. All right, everybody, that's it for today. Until next time, Dr. Z here, and remember, take it easy.